Drug-receptor interactions and pharmacodynamics. Question number 1. Isoproterenol produces maximal contraction of cardiac muscle in a manner similar to epinephrine. Which of the following best describes isoproterenol? A. Full agonist. B. Partial agonist. C. Competitive antagonist. D. Irreversible antagonist. E. Inverse agonist. Correct answer equals A. A full agonist has an Emax similar to the endogenous ligand. A partial agonist would only produce a partial effect. An antagonist would block the effects of an endogenous agonist. An inverse agonist would reverse the constitutive activity of receptors and exert the opposite pharmacological effect. Question number 2. If 10 mg of naproxen produces the same analgesic response as 100 mg of ibuprofen, which of the following statements is correct? A. Naproxen is more efficacious than is ibuprofen. B. Naproxen is more potent than ibuprofen. C. Naproxen is a full agonist, and ibuprofen is a partial agonist. D. Naproxen is a competitive antagonist. E. Naproxen is a better drug to take for pain relief than is ibuprofen. Correct answer equals B. Without information about the maximal effect of these drugs, no conclusions can be made about efficacy or intrinsic activity. E is false because the maximal response obtained is often more important than the amount of drug needed to achieve it. Question number 3. If 10 mg of morphine produces a greater analgesic response than can be achieved by ibuprofen at any dose, which of the following statements is correct? A. Morphine is less efficacious than is ibuprofen. B. Morphine is less potent than is ibuprofen. C. Morphine is a full agonist, and ibuprofen is a partial agonist. D. Ibuprofen is a competitive antagonist. E. Morphine is a better drug to take for pain relief than is ibuprofen. Correct answer equals E. Based on the information presented here, since morphine is more efficacious than is ibuprofen, it is going to provide more pain relief. As long as the situation warrants the necessity of such efficacious pain